CCMA NHA 2026 Review. Question 1. A patient calls requesting a copy of their medical record to be emailed to a personal account. What is the CMA's most appropriate action? Email the record immediately if identity is confirmed. Refuse the request entirely. Require a written HIPAA-compliant authorization before release. Send only partial records without authorization. Medical records require written HIPAA-compliant authorization before release, even with identity verification. Email transmission carries security risks, so proper authorization protects patient privacy and ensures legal compliance. Question 2. A claim is denied due to non-covered service. What should the CMA verify first? Provider's NPI number, patient's eligibility and benefits for the date of service. Office hours, ICD-10 code spelling only. Non-covered service denials often result from the patient's insurance policy not covering the specific procedure. Verifying eligibility and benefits for the date of service helps determine if prior authorization was needed or if the service is excluded under the plan. Question 3. A patient arrives without an appointment requesting urgent evaluation for chest pain. What is the correct administrative response? Ask the patient to complete paperwork first. Inform them no walk-ins are allowed. Immediately alert clinical staff. Schedule the next available slot. Chest pain may indicate a life-threatening emergency such as myocardial infarction. The CMAA must prioritize patient safety by notifying clinical staff immediately without delaying for administrative processes. Question 4. A provider wants to implement a double booking system to reduce no-shows. What is a potential risk? Increased patient dissatisfaction due to delays, reduced patient wait times, improved workflow, lower staff workload. Double booking can maximize provider productivity but may result in longer wait times if all patients arrive. This can negatively impact patient satisfaction and office efficiency if not carefully managed. Question 5. A patient disputes a charge for a procedure performed 3 months ago. What documentation should the CMA review first? Staff lunch schedule, appointment reminder log, explanation of benefits, EOB, and patient ledger. Marketing materials. The EOB explains how insurance processed the claim, including patient responsibility. The patient ledger shows all charges and payments. Reviewing both provides accurate clarification before responding to the dispute. Question 6. Which action best protects protected health information, PHI, at the front desk? Calling out full diagnosis allowed. Positioning computer screens away from public view. Leaving files open for convenience. Sharing passwords among staff. Physical safeguards such as positioning computer screens away from public view reduce unauthorized viewing of PHI by other patients or visitors. HIPAA requires administrative, technical, and physical safeguards to prevent accidental disclosure. Question 7. A patient's insurance requires prior authorization for a diagnostic MRI. When should this be obtained? After the procedure, before scheduling the procedure, during patient checkout, only if the claim is denied. Prior authorization must be obtained before the service is rendered to ensure payment eligibility. Failure to obtain prior authorization may result in claim denial and financial liability for the patient or practice. Question 8. A provider documents rule out pneumonia. How should this be coded for outpatient billing? Code pneumonia as confirmed. Use a surgical code. Leave diagnosis blank. Code the presenting symptoms. In outpatient settings, unconfirmed diagnoses like rule out are not coded as definitive. Instead, code the documented signs and symptoms, e.g., cough, fever, until a confirmed diagnosis is established. Question 9. A patient pays $50 at check-in toward a $150 balance. How should this be recorded? As a contractual adjustment, as bad debt, as insurance reimbursement, as a patient payment on the account. Direct patient payments must be accurately posted to the patient ledger to reflect the reduced balance. Misclassification can cause accounting discrepancies and billing confusion. Question 10. A claim is rejected due to incorrect patient demographic information. What should the CCMA do first? Resubmit without correction. Contact the patient to verify information. Ignore the rejection. Change the provider name. Incorrect demographic details commonly cause claim rejections. Verifying information directly with the patient ensures accurate correction before resubmission. Question 11. Which scheduling method groups similar procedures together to improve efficiency? Wave scheduling, open booking, cluster scheduling, modified wave scheduling. Cluster scheduling groups similar appointments such as physical exams or minor procedures together to streamline workflow and equipment use. This method enhances time management and provider efficiency. Question 12. When handling a subpoena for medical records, the CCMA should first notify the provider or legal department, ignore the subpoena, release records immediately, call the patient for verbal permission. Subpoenas involve legal obligations and must be reviewed by the provider or legal counsel to determine validity and compliance before releasing any records. Releasing without review may violate patient privacy laws. Question 13. A patient's account shows a credit balance. What is the appropriate action? Keep funds indefinitely. Apply to another patient's account. Refund or apply per patient instruction. Delete the balance. Credit balances must be resolved ethically and legally, typically by refunding the patient or applying the credit as directed. Keeping funds violates financial compliance standards. Question 14. Which form must a new Medicare patient sign acknowledging financial responsibility? CMS 1500. Advanced Beneficiary Notice, ABN. HIPAA Privacy Notice Only, OSHA Waiver. An ABN informs Medicare patients that a service may not be covered and that they may be financially responsible. This protects the practice from denied claims by establishing the patient's agreement to pay. Question 15. What is the purpose of reconciliation in medical billing? Hiring staff, coding diagnosis, scheduling appointments, comparing payments posted with deposits received. Reconciliation ensures that all payments received match recorded transactions. This prevents financial discrepancies and identifies posting errors or potential fraud. Question 16. A patient requests amendment of information in their medical record. Under HIPAA, the patient has the right to demand deletion immediately, request correction with review by provider, rewrite the entire record, access other patients' records. Patients may request amendments to their medical records. The provider reviews the request and determines whether to accept or deny the change based on clinical judgment and record-keeping standards. Question 17. A patient becomes angry about wait times and raises their voice. What is the best CCMA response? Argue back. Ignore the patient. Remain calm and acknowledge concern. Ask them to leave immediately. Professional communication involves active listening and empathy. A calm response that acknowledges the patient's concern helps de-escalate tension while maintaining a respectful environment. Question 18. What is the primary purpose of ICD-10 CM codes? Identify procedures performed. Report diagnoses and conditions. Track staff schedules. Bill for equipment. ICD-10 codes classify diagnoses and medical conditions, supporting medical necessity for services rendered and claim processing. They answer the question, why was the service performed? Question 19. When verifying insurance eligibility electronically, what information is essential? Patient's favorite pharmacy, policy number and subscriber information, office zip code only, staff ID number. Accurate policy and subscriber details including policy number, group number, and member ID ensure eligibility verification matches the correct insurance plan. Missing information can result in errors. Question 20. A provider performs a minor in-office surgical procedure. Which coding set is primarily used to report this service? ICD-10 PCS, HCPCS Level 3, CPT, DRG. CPT codes describe outpatient medical, surgical, and diagnostic services. Accurate CPT coding ensures appropriate reimbursement and compliance with billing standards for procedures performed in medical offices. Question 21. A claim is returned with the remark code indicating invalid modifier. What is the CCMA's best next step? Delete the entire claim and start over. Review the CPT code and modifier combination for appropriateness. Bill the patient directly. Ignore the remark and resubmit unchanged. An invalid modifier error usually occurs when the modifier does not match the CPT code or payer policy. Review coding guidelines to ensure the modifier accurately reflects the service provided before resubmitting. Question 22. A patient requests information about another patient's appointment time. What is the correct response? Provide the time if they seem trustworthy. Confirm only the provider's schedule. Decline to share due to privacy laws. Give limited details without name. Appointment information is PHI because it confirms that an individual is receiving care. Sharing any identifiable details without authorization violates HIPAA regulations. Question 23. Which document is typically used to submit professional medical claims to insurance carriers? UB 04, CMS 1500, Explanation of Benefits, Remittance Advice. The CMS 1500 form is used by providers in medical offices to submit professional service claims. The UB 04 is generally used for hospital or facility billing. Question 24. A patient's insurance policy terminated 2 days before their visit. What is the CCMA's appropriate action? Backdate eligibility. Inform the patient and discuss payment options. Bill insurance anyway. Cancel the visit after service. If coverage has terminated, the patient may be financially responsible. The CCMA should inform the patient respectfully and provide payment options or self-pay arrangements before the visit. Question 25. What is the purpose of a clearinghouse in medical billing? To provide direct patient care, to schedule appointments, to review and transmit claims to payers, to collect co-payments. A clearinghouse acts as an intermediary between the provider and insurance companies, reviewing claims for formatting errors before forwarding them. This reduces rejection rates and improves billing efficiency.